I think that what we're witnessing is one of the largest human capacity crises in the developing world. And to request those people to come and get trained outside of their country takes them away from their day-to-day activities in an already overstretched, overburdened health system. So one of the things that we do is by engaging some of these providers in their settings, we provide an avenue for them to get continuing medical education, to get timely updates, and to have interaction so that they don't feel isolated in their workplaces, because that's one of the biggest issues, is this sort of feeling of working in isolation in a really busy clinic. And that's probably one of the very gratifying values that we add to these settings.
In other parts of the world, it's still like it was here back in the 1980s. HIV is almost a death sentence in some of these places. But recently, the medications that are life-saving have come there, and what we need to bring with those medications is the knowledge of how to provide them. And we have that here. We know how to do it, we've learned how to do it, and we need to give that information to them so that the patients there can have the same benefits of these medications that our patients have realized here. And I think what the center will do, and is already doing, is improving life expectancy in parts of the world where it's needed most.
The volume of training and the quality of training needs to completely be realigned. I think it would be great to put some fair amount of money into training people that will sustain research capacity per se for the future. And this would be really training Africans, Ugandans, so to say, to be able to manage these funds, as we move on to the future.
In my opinion, people who work in academic medicine are compassionate. You've already got good people. So if you can empower them, then you've got great people, and that's why, to me, this kind of model will work and will scale up. It's just that the challenge is to be educated and to give them the training, the knowledge, the medicine, the equipment, the technology, which is all coming together.
We've chosen a mission that is targeting the most vulnerable and poorest communities in the world with the greatest need. And obviously they don't have the resources to support and pay for education from a place like Hopkins. So we have to come up with cost-effective strategies to deliver that kind of education, high-quality education, and we need partners to help support the cost of doing that, because the communities in which we work and the providers that we train don't have the resources themselves to pay for that education. So we're really looking for partners who are interested in our mission and recognize the value of our approach as well as the impact of our approach and the cost effectiveness of some of the tools and approaches that we've implemented in these programs.